I'm really excited to be making this video for the very first UK Health Coaches Association conference. It's a pretty momentous occasion and is much needed. I know some of you, I've trained as a health coach, and like me, I know that you are passionate about seeing change within the health service. I've worked in conventional medicine for over 25 years, and I would say over the last 5 years or more, I had an increasing awareness of the need for change. And when I became a patient, I took the opportunity to explore lifestyle change, and like you probably had my own health journey and realised that there was much that I could do if I took control of my own situation rather than being the passive recipient of medication. It became very clear to me that our bodies have the amazing potential to heal themselves, and that might seem as if it should be pretty obvious to a doctor, but actually often we get very caught up in the pressure to prescribe, the time constraints that we have when we see people in clinics and in surgery. And so we need change. We need to work together to find a way forward, and I'm sure we can do that. My vision is to see wellness centres instead of the current sick service that we have. I would love to see wellness centres up and down the country, full of health coaches. And within my own work as a rheumatologist in the NHS, I can see the potential for group consultations facilitated by health coaches, and the same within general practice in the community. There are huge possibilities. We just have to be innovative, imaginative, and be keen to collaborate and push some doors, knock at some doors, quite literally. And I know that can be difficult, but the tide is turning. I feel that and see that every day, and it's really energising. It's incredibly promising for the future, and I think we have a very exciting time ahead of us. And I think if you're feeling anger or frustration, please try to focus that into how we can really drive health coaching in the UK. Let's come together, let's see the possibilities, and use today as an opportunity to network, build connections. We can't do this on our own. We have to work together, and we can change the current system where we are dividing people up into systems of a gut problem, a gynae problem, a chest problem. We need to recognise the whole person, and we need to, very importantly, recognise the mind-body connection and continue to develop and recognise possibilities for change in our own locality. So leaving you today, I hope you have a wonderful time, and I would just ask you to think of one thing that you can take away from today and use to make change where you live and work, and hopefully we can have that ripple effect that we all recognise. It's incredibly powerful. So better that we all work together, and I'm sure we can do this. We can do this. So thank you very much. Thanks for listening.